You've landed at the edge of what medicine has known and what it's becoming. I'm Dr. Richard Rocker, and this is the Integrative Continuum, a podcast bridging biology, energy, and human potential. In each episode, we explore how quantum biology, frequency medicine, and ancient healing systems are transforming our understanding of health. This is where mitochondria meet meaning and blood work meets bioenergetics. Subscribe now and join me on the frontier of integrative healing, where science and soul are no longer separate.
Welcome back to the Integrative Continuum. I'm your host, Dr. Richard Rocker. On this show, we explore the cutting edge of functional, integrative, and natural medicine to help you unlock deeper healing and resilient healing. Today, I'm honored to be joined by Dr. Carsten Nicolaus, MD, PhD, a world-renowned expert in the treatment of Lyme disease and tick-borne illnesses. He is the founder of the BCA Clinic in Augsburg, Germany, where he and his team have treated over 25,000 patients since 1990. He is recognized for pioneering a hybrid conventional herbal TCM approach, training over 1,500 physicians, and advancing diagnostic methods such as LTT and ELI spot testing. Currently, he serves as Chief Medical Advisor for Makewell, supporting nutrition-based approaches, education, and global training. There's a few other positions as well that I'll let Dr. Carsten fill you in on as well. So Dr. Nicolaus, welcome. It's such a pleasure to have you.
Oh, thank you for inviting me.
Excellent. So let's get this all started off. So I think the great question to start off is, what inspired you to specialize in Lyme and tick-borne illnesses?
Well, there was no certain reason. That was more randomly. So when I started my medical career, I was in parallel to my medical training, research fellow in a research department for transplantation medicine at the University of Munich. And I became very interested in developing a specific test system to identify patients before or after getting a transplant in better diagnostics. So, there are similar problems as of today. I'm always used to problem of diagnostic to differentiate between acute and chronic infection. So that was my main focus. And so beginning of the 90s, I was looking for some new challenges. And so I made a general decision to leave hospitals and to build up my own practice. And at this point, I wasn't aware that I always lived and practiced in Germany's highest endemic areas for tick-borne diseases. And so it happened what it must happen. So even in the first week, I got first time in my life in contact with a patient suffering from Lyme disease. And I have to say, at that point, I had no clue about Lyme or other tick-borne diseases. So, but as a well-trained doctor, with the background of as a scientist, I became very interested, and I tried my very best to find a solution, which was not very easy at that time because we are talking about illness, or specifically Lyme disease, was discovered around about 10 years before at the east coast of the U.S. in this little village or area of Lyme in Connecticut, and all our experiences have been based on information, easy to diagnose, easy to treat with simple antibiotics. For 2 weeks, everyone is cured. But unfortunately, that never happened to this first patient. So when he approached me, he was in charge of many other doctors for around 5 years, and he was looking for a solution, but no one was able to offer any solution. And for me, it was really a big challenge. But based on my former time as a research fellow, I had almost a really good contact to the East Coast. So there have been a lot of collaboration with some departments at Harvard University for transplant research purposes. And so I tried my very best to keep in contact with some of my former counterparts, hoping to get more insights of tick-borne diseases. And I was lucky to get really some good recommendation how to proceed. And this was a complete different approach as I got in the meantime in Germany. So I was lucky, and fortunately I found a good way in treating this guy. But again, this was more randomly and more on empirical finding than really based on real science at that point.
Okay,
So,
fantastic.
but this is how it is. So if you're living and working in a high endemic area, so it won't leave with one patient. So when the real, and that was in wintertime, by the way, in 1991, and a bit later, when at that time the tick season started, so it was end of March, beginning of April, more and more patients came into my new practice asking for support, mostly at the beginning for acute stages after tick bite of Lyme disease. So at that time, no one was focused on co-infection. It was just to find out about a Borrelia infection. That took a while to learn more and to get really more and more insight about the complexity of these illnesses.
Excellent. And you mentioned some of the areas in Germany and in the East Coast of the United States. Are there any other areas that that we would find?
Yeah, definitely. It's a worldwide problem. So,
Yeah.
so at the moment, there's evidence in minimum 120 to 130 countries worldwide dealing with tick-borne diseases, or specifically with Lyme disease. And, the latest number published by the WHO are reporting about probably 1.3 billion people infected with Lyme worldwide. So that was a meta study out of more than 4,000 national and international studies, when we learned that round about 15% of the people had contact with Lyme or are suffering still with Lyme. So it's a huge number, and everyone can imagine how serious the problem is. But we are unfortunately still at a point where the training of doctors is not the best. Fact is that everyone's believing in the medical scene is easy to diagnose, easy to treat, but it isn't. And my observation is that most of the time patients are much better informed than many doctors, unfortunately.
It seems in this day and age there is, because we have access to so much information, which listen, I think it's a great thing. And if you can take that information to your doctor and work with them, you're working as a team to solve the issue, really. Yeah.
Yeah. And
Yeah.
this is one of my passion, is really when I really got aware how serious the problems are with chronic condition. And for me, it was quite obvious right from the beginning that many people in my old area had really chronic conditions with Lyme without knowing it. And when I got more and more insights, I digged always deeper. And so I'm 100% sure that 20 to 30% of all my patients I have seen locally had a history of tick bites, had a history of unknown Lyme conditions. And this is what I'm still observing. So in most of the European countries, or I would say in all European countries, we have the same issue. So there are some hotspots, but generally the tick-borne diseases are widespread and seen more or less everywhere. There are some hotspots where you have definitely multiple other tick-borne disease at the same time, but the incidence of Borrelia is very high all over Europe.
So what would make the certain areas hotspots that they would be more prominent? Is there something in the environment? Is the time of year, season?
Yeah, so the mentioned tick season is not anymore seen. So, based on the climate change, on the global warming, ticks and the tick habitats are getting bigger and bigger, and the numbers of ticks is also on rise. There's absolutely no doubt, and all the latest published numbers are confirming this. So you're right. The environment is definitely very important for ticks. And when I started my career, it was said ticks are sitting in big trees and they are waiting for humans. And when you're under a tree, you will be, the ticks are jumping at you. That was completely nonsense. So most of the ticks you will find close to the earth. So so generally we have three stages for ticks. So so it will start with the egg stage. Yeah. Then so these eggs need a tiny bit of blood meal to enter the next cycle, which is the young tick or nymphs, which are tiny ones, just 1 millimeter of size. And these ticks, these nymphs will need another blood meal from whatever it is, animals or humans, if we are in their habitats, then to make this transition in adult ticks. So compared to other biting or sticking insects, so ticks has a huge reservoir and can carry, based on the latest publication, more than 400 different infectious diseases. So that is a lot more than any other sticking or biting insects. And also the lifetime of ticks, which is most of the time a couple of years, give them much higher chances to get in contact with the host and any forms of animals or humans. So and if you compare the lifetime, let's say, of a mosquito compared to a tick, the tick is definitely much ahead, and this is one of the reasons why we get why we are getting more and more problems in certain areas. And if the living conditions are great, so some humidity, grassland, bushland, not the big trees. This is definitely not what ticks are looking for. But if there's a lot of grassland and bushland, so then ticks are feeling very comfortable. And the activity starts from temperature above 5 degrees Celsius. So that means, and due to the global warming, only temporarily we have really hard winters with a lot of freezing. But without that, the ticks are quite well protected in the earth, and they can survive. And this is one of the reasons why we see at the moment constantly increase of the tick populations and the number in the population.
So it sounds like where I'm living in Ireland, it's a prime area conditions for that.
No, you're absolutely right. So I personally have treated patients from all more than 100 countries worldwide. So I have a good understanding what is ongoing in many different parts of the world. And one of the hot spots worldwide is definitely Europe. And so in the past 20 years, I've definitely seen hundreds of Irish patients who came to Germany for treatment. And a long time ago, I started also with first training courses in Ireland. So this is when I came across with Professor Lambert from Dublin, who definitely showed up with huge interest. So when he acknowledged that there are big problems, he invited researchers and doctors from different countries to raise more awareness, to get better training for Irish doctors as well. And when we had the first session, I guess that was 2016, our expectation had been that probably 10 or 20 doctors will join the workshop in Dublin, but everyone was surprised that we had nearly 60 doctors. There was huge interest at that time.
Oh, great. Yeah. Well, maybe we can get you here again. That would be fantastic.
Yeah, but they so far in the past couple of years they had been on a regular base workshops and conferences in Dublin, most often organized by Professor Lambert's university
Sure.
department, and I guess he's really doing a great job in spreading awareness and hopefully to convince more and more doctors not to ignore and to deny anymore the existence of Lyme or other tick-borne disease in Ireland. There's good evidence that there's really a major problem, not only based on Borrelia. So we see on a regular basis co-infection, more and more cases of Bartonellosis, more and babesiosis, and Ehrlichia and Anaplasma is also very much present in Ireland. And it's a green island and well known. It's one of the centers of tourism, and even the Irish people are exposed to that risk, and also the visitors of this beautiful country.
Now, is there something particular about a person that may attract a tick or a Lyme bug?
Yeah, there had been studies to measure in some way the attractiveness of different people, and it's a matter of your odor. Yeah, so some people are smelling very interesting for ticks, others not, and it's good to know that ticks do not have any eyes, so they can't see their hosts. So it's a matter of smelling and finally tasting. Yeah, and ticks. Most of the tick species we have here in Europe are very resident. They are on grass farms, for example, waiting that someone came across their ways, and then with their long legs, they try to get in contact with humans or with animals to get a chance of a bite, and finally a tiny blood meal. This is what they want to achieve.
Okay, all right. Okay. And what is it when a tick-borne or a Lyme bug bites you? What is it that creates such a big reaction? Why maybe it less in certain individuals and more in another?
In the early days, it was said, so after tick bite without an erythema migrans or bullseye rash, this is this typical ring-like redness. There's no transmission of the bacteria, but that was never correct. The EM or erythema migrans is not one of these obligate criteria patients have to fulfill to get transmission of Borrelia bacteria or one or several of these co-infection. If such an accident had happened, so if you have a tick attachment, a tick bite, and if the tick is, let's say, there for a couple of hours or most often longer than that, 1 to 3 days until persons will recognize a tick bite. So, they are not looking for places which are always best overseeable. So they are looking for niche under axilla pads, backside of the knees, or in the groin. So, there are many places where you can't notice immediately that there was a tick bite. And if we take in consideration that 60% of the infection probably had been transmitted from the nymph, so these tiny ones, just 1 millimeter of size, it's definitely quite common to oversee that. Yeah, and there's another difference between nymphs and adult ticks. So adult ticks are definitely much bigger, so 3 to 4 millimeters. And when they start with the blood sucking, they will definitely going bigger and bigger. So up to a size of a grave, for example. Yeah. So then it's not a problem to see them. But a nymph needs only a tiny bit blood meal, and the nymphs are very vulnerable. So you can easily have a nymph bite on your upper arm, and you can scratch a nymph away. While adult tick, you can't scratch away. You need a certain instrument or tool to remove the tick. Yeah, and then it's much easier. So the recommendation in general is, if there was any forms of tick attachment, on one hand, you should for the next couple of days have a look on the area of the tick bite. If you see any start of redness or the ring form redness, then finally you don't need any lab check. So if there is a clear evidence of an erythema migrans or bullseye rash, this is confirming the diagnosis of transmission. So you can immediately contact a local GP, and usually the GP should put you on antibiotics. Yeah, it's so there is no question. But very often, so erythema migrans, according several studies, are only occurring in about less than 50%. So sometimes you won't notice any redness, but that means you are safe. Then you have to look for other criteria or symptoms. So the very well known flu-like symptoms, having some headache, some being unwell, having some feverish or fever feeling. So it's an cold without coughing and running nose. Yeah. So if you notice something like that, then the likelihood of having had transmission is very high. So if that happens, and if you're living in high endemic areas, and I would say out of scratch that island is such an endemic area, I would always recommend after tick bite, roundabout late, even being symptom free. If you want to stay on the safe side, I would recommend after earliest 10 to 14 days. So it takes some time after the transmission that your immune system will start with the production of first antibodies. So the first one are the so-called IgM antibodies, and our immune system needs that time to produce the antibodies. So a very often made mistake is directly after the tick attachment or removal of a tick, same day to take some blood. So if you do so, I'm not wondering if the outcome is negative. You have to wait a certain time, and this is quite okay. There is no need to be treated immediately. And this is the difference between having an EM. If you have an EM, you have a safe diagnosis right from the beginning. Then you can start out of scratch. If you don't have any of these skin pathologies, you can wait until getting confirmation of transmission. So, and that takes up to 2 weeks. If it's negative, so depending on the quality of the test system, it does not rule out in 100%, but then you are definitely safer as before. If there's evidence of IgM antibodies, latest at that point, you should start with treatment.
So then, if a patient were to get standard immunoglobulin antibodies, would that be sufficient, or should we look at maybe the differences?
Many of the standard tests, and we have the two-tier testing. It's more or less according law or medical authorities. You have to start with always with an ELISA test, which is unfortunately not a very accurate testing. So based on 7 big studies, it came up that 50% of the patient will fail in the ELISA test, and only if the ELISA test is positive, so confirmation of IgM or IgG antibodies or both, then the lab is required to do a confirmation test. This is a much more sensitive type of testing, a Western blot testing with, let's say, specificity. The specificity is always very high in both types of test system, but the sensitivity is even higher for Western blot testing. So so roundabout, depending on the lab, between 80 and 92%. So let's say the percentage of having a risk of missing the transmission is much smaller than compared to an ELISA test. So the takeaway message is you need under certain circumstances some diagnostic, but you can't 100% trust the diagnostic. So that means if there's any change of your clinical or if you notice any clinical symptoms, the ones we have mentioned, erythema migrans, flu-like or general weakness, chronic fatigue. No, we can't say chronic fatigue and some malaise. There's definitely some likelihood. Or, and this is if the tick. If the Borrelia will get immediately access to the vessel system, then it might happen that we can enter directly the second stage of infection. And this is where specific organ system could be affected. You can immediately access directly to the nervous system, causing any forms of paresis, for example. Commonly seen paresis of the eye muscles, oculomotorius nerve could be affected. More often you see the Bell's palsy, for example. If that happened, then you have to be treated immediately and more invasive.
So then beyond the standard serology, then why would the LTT or the ELI spot be more valuable?
I was part of this group developing the first generation, the LTT or lymphocyte transformation testing, because the first use was in transplant medicine. And it took nearly 10 years to transfer this knowledge in diagnosing tick-borne diseases. So I guess one of the trailblazers had been Professor von Beer. He was head of a specific research department at the Charité, Germany's biggest hospital, and later on he set up a lab in Berlin called IMD, and they have introduced the first available LTTs for tick-borne diseases. Meanwhile, we are in the fourth generation, so so everyone is aiming for better testing, and so since I guess year 2004, 2005, the LTT was more or less replaced by a new technique, which was first time standardized for all labs, the ELISpot technique. ELISpot is very similar to LTT, but the setting and the pre-analytic is different. It's completely the setting is completely fixed. So that means the outcome of the test results had been first time comparable between different labs. Which never happened with the LTT test, because the incubation time was much longer, up to 5 days after getting the antigens in contact with the T lymphocytes. With the ELISpot technique, the incubation time is just 22 hours. And this has a certain meaning for this technique. So with it will take, if you have a longer incubation time, you're getting more information as you want to get. So the information is getting more unprecise. Other reaction could be measured, and you have some certain background noises before getting the test results. And that has changed with the introduction of the ELISpot technique. So if you constantly go only for 22 hours incubation and some other pre-analytic conditions, you will always get the same setting, and that means you can compare the results from lab Y to lab X. Yeah, and we are meanwhile in the fourth generation, so we are not looking any longer only for the gamma interferon release, which is giving us the information how serious the infection is, and this technique is definitely much more advanced, much more sensitive, and that gives doctors and patients more often a chance to get at earlier stages the information of ongoing problem. So to identify acute stages, but also chronic conditions. And the last generation called iSpot is measuring a second a second cytokine beside gamma interferon, the interleukin 2. So that means we get additional information about other ongoing problem. So the production of memory cells and inflammation. And this gives you the chance to differentiate much better in which stage patients are.
So if I'm a patient that is suspicious of it, and I'm looking for testing beyond the standard, the 2-tier testing, if I go down to my local doctor, are they going to have this test available? And if not, how would I be able to get that?
I'm doubting. So I'm not aware of any lab at the moment in Ireland offering these type of testings. Unfortunately, the same situation is in UK. Germany had a long tradition of being really good in diagnostic. But if you go in other European countries, to France, to the Netherlands, even to Poland, so it's a well-introduced technique. Meanwhile, and also in Spain, or I would say in the overall majority of countries, ELISpot or iSpot technique is available. It's a common and routine type of diagnostic. So if an Irish patient wants to get access, you can do the blood draw with a local nurse or with a local GP, and then there's an overnight shipment to any of these places. So it could be Germany, could be another country, to get access to the testing. And sometimes it will be the first time in getting confirmation for chronic conditions. So I see quite a high percentage of patients who have been almost negative tested in ELISA and Western blot, and later on, when a patient have first time access to this very sensitive form of testing, there was evidence of having chronic conditions, and this is quite helpful. So in the medical books, it's still mentioned Lyme disease, and some of the other tick-borne diseases are based on clinical diagnosis. And if you are lucky, you can get confirmation by doing certain lab tests. This is correct, still correct. And I would trust more my skills and my experience than looking for the outcome of testing, I have to say. But looking from an angle of an insurance, they want always evidence in paper form. So either they deny when the antibody testing was negative, so probably you won't get any coverage. Only if they would accept, let's say, medical notes from other doctors pointing out that there's really great evidence in these new forms of diagnostic, and it's definitely one of the best and sensitive test method, and so it's meanwhile the gold standard in Germany.
Yeah, that's excellent. Yeah, I've heard a lot of great things about the testing in Germany, and I myself have sent patients' tests down to Germany for more accurate testing, because we can only get the 2-tier testing
I know, and
that's available. So when we talk about the immune system, how do we identify co-infections and active infection, let's say, versus immune memory?
Richard, this is a really good question and very important. So seeing patient with Lyme is a rare finding because it's not that isolated infection with Borrelia. In more than 90%, patients have at the same time transmission of other bacteria, parasites, or even acquisition of viral infection. The reason behind is that Borrelia is one of the most intelligent bacteria. So it's quite obvious. So the genome is 3.5 more than any other bacteria. And that allows Borrelia for really very specific tasks in the host organism. That means they can move to any place actively. They are not depending on the bloodstream, for example, or other body fluids. They can imitate the body language, and they can communicate between the different bacteria. So they are sending out hormone-like. It's not the same language we are now talking. So it's more based on sending out similar like hormone-like stuff. But they can inform each other, and they can send out signals to our immune system, telling the immune system, "Hi guys, we don't need you any longer." And this is when patients are entering after 6 months chronic stages in undiagnosed or unknown chronic conditions. Then our immune system is getting weaker because Borrelia tries everything to make it survive as best as possible. So it will cause a scale down of the host immune system, animals similar like humans. That opens the upper respiratory tract, and we are more sensitive in catching up via our eyes, nose, mouth, and lungs with other airborne transmitted infection. That means that more than 90% of patients with chronic or late stages of Lyme disease, means Borrelia infection, will automatically have on average 4 to 6 other infectious diseases reactivated at the same time. For this reason, it makes definitely sense to differentiate between different pathogens because that will determine the best treatment approach. Whatever you have in mind, conventional treatment, mixed protocols, or alternative treatment. But you need this information, and you need also a clear determination how immunocompromised are the patient. So I would highly recommend, beside the diagnostic test, also to include something to get an overview about other health condition, to find out how weak or how good the immune system is working. And they are quite easy to perform tests, routine tested at the same time, to get this understanding how weak or how good the patients are, because that will have definitely some impact on your treatment later on.
Yeah, absolutely. I'm a really big proponent of having very comprehensive blood tests. So when we work with our patients, and I find the problem these days is when people go down to their local doctors, they're getting such a very basic test. You're getting like maybe 15 to 20 blood markers, and I look at it and going, well, how am I going to figure out what's going on in the body with such little information and not even any immune or inflammatory markers? So I'm in total agreement with you with that. And often, if you do a comprehensive enough test, you can see, hey, there's a pattern here, that there's something going on. We just need to figure out what that something is. Yeah.
No, you're absolutely right. And, this is what I meant at the beginning. So, the complexity is much bigger, as everyone knows. And, so that was my learning in the past more than 30 years. So I started really being focused only in diagnosing the transmission of Borrelia. So my learning curve again uphill year by year. So it's not only the issue dealing with multiple infectious diseases or reactivated diseases at the same time. So other health conditions are almost seen in parallel. So it can affect the immune system, as we have discussed, but you can see also very specific other health condition. So 90% of the patients have a history of chronic fatigue and tiredness. Others will develop things like MCAS, mast cell activation syndrome, very serious forms of gut issues. Multiple other health conditions at the same time. And this is nothing we can ignore. And, this is why doctors for integrative medicine have definitely a different focus. They are aware about the complexity, and they are not, if someone has an infection, they are not only focused to give them some antimicrobials. So they are looking for other conditions conditions as well to support the patient best. And, to make it short, if we are dealing with such patient, you have to be focused on what we nowadays call the 3 I's, the infection. So this is the first step, to identify potential invaders into the host organism. Secondly, if you have chronic condition, or means chronic infection, you have automatically an uncontrolled upregulation of inflammation. So inflammation could be found locally where the pathogens are, but you can also find systemic inflammation, so that the inflammatory markers are highly upregulated. And many of the symptoms are not only caused by the infection, so they are definitely more likely caused by the inflammation. But this is not all. The third I is really, we have to be focused on our immune system. And the overall majority is really completely immunocompromised. That means these patients need additionally support to enhance their immune capacity. And if we ignore that, patients have much delay if they can achieve really good outcome.
Excellent. So I want to get into a little bit about your therapy approach. So you've developed a hybrid therapy approach. So what are your core principles in regards to that?
Looking specifically for the 3 I's. This is
Okay.
so based on that, I have developed my own approach. So basically, this approach is based on 8 different columns. So first of all, to identify the invaders, then to look for inflammation. Then these patients in chronic condition will develop multiple deficiency, vitamin deficiency, mineral deficiency. This is also something you have to find out right at the beginning. And then when it comes to treatment, so the treatment is on one hand, again, focused to fight the bacteria, viruses, or parasites. So most of the time, parasites are seen in form of Babesia, sometimes other ones. And in some certain areas of Europe or worldwide, you're dealing with very specific parasites. But let's be focused only on Europe or the northern part of Europe. So the most often parasites we are seeing is Babesia, which is similar one like malaria, most of the time resident in the red blood cells. So, but the other columns are also very important. So dealing with these chronic conditions, infection, inflammation, deficiency, that will automatically cause high levels of stress. So these patients, which we see, have really a history of complete disbalance adrenal systems after a while. So they have disbalances in many hormonal pathways. So this is quite obvious. At least we should definitely take care for the stress levels with certain support. And beside of that, you have also in minimum 80% chronic pain syndromes. This is what you see quite often. So these patients have the serious form of chronic pain, most often what we call neuropathic pain. So that means based on the invasion of the bacteria, most of the time Borrelia and Bartonella, they are trying everything, some of these species, to get immediately access to your nervous system. They can affect your brain, your cranial nerves, your peripheral nerve system, but also the autonomous nerve system. And so that means a good treatment means in parallel also to take care for the high pain levels, because pain is the biggest stressor for our immune system. If you ignore pain, you will find much delay in the response of patient on your treatment. And so I would also include any forms of mild exercising and training. So that means we can rely on good studies confirming that in chronic infectious disease, in acute infection, viral infection, bacterial infection, you have to rest. There's absolutely no doubt. But we are talking about chronic conditions, and patients with serious illnesses like cancer, like autoimmune diseases, but also chronic infection or chronic inflammatory processes, they will take advantage out of some mild exercising on very mild levels. So at the beginning, it's more recommendable to go for some cardiovascular training. So that means walking, some biking, some swimming. So wait at the beginning to go to the weights. This is definitely not the best start. So keep it on a mild level. If you're very tired, start only with 10 minutes walking once a day, and then go slightly up twice daily, 3 times daily, short distances. You will definitely notice very soon the benefits of the treatment. So over the time, you will develop better and better stamina, and that means this is an additional support while exercising. Certain parts of your body will start to produce endorphins, and these endorphins will support your immune system and will definitely lift you on a much higher level of stamina.
Yeah, that totally makes sense. It's really good. I think a lot of people, they try to do too much too quickly, and like you said, they overstress the immune system that's already in this fight or flight states, and then you just get the cascade, cortisol production, inflammation, tissue breakdown, and you never get ahead. So
Yeah,
now
absolutely right.
I'm very big at using cold and heat therapies like infrared saunas, ice baths, and that. How would that fit into this? Would that be beneficial?
I'm absolutely a big fan. When I started to treat my patient more holistically, I looked really for some treatment without using any medication. And one of the first I've introduced was to offer my patient ionized oxygen and infrared sauna treatment. So there's much evidence. Meanwhile, so at the beginning it was only based on empirical findings when I started to introduce that in my general treatment approach. But meanwhile, we can rely really on good studies. There's a lot out there which can really support patients in achieving much faster and much better high levels of improvement. And so just to give you an example, so in my former clinic, we offered in the day clinic a daytime treatment. So patients got certain medication in the morning, after some mild exercising, after some offering some ionized oxygen. Then they got certain physiotherapy, massage techniques, but also we had also included some of these electro devices. So there was one device which was very commonly used for patients with chronic pain syndromes. It was called high tone frequency device. So with very high frequencies, you can scale down the pain at nearly all body locations, for example. And other treatments like ozone treatment could be part of these treatment approaches. And at the end of the day, patient had been asked to join for at least 20 to 30 minutes an infrared sauna. Why infrared and not a normal Finnish or Swedish sauna? It's a matter of temperature. You know, if you're in weak condition, probably you can't stay even 10 minutes in a super hot Finnish sauna at 90 degrees Celsius when you are close to collapse or collapsing. Yeah. So then, and this is the advantage of infrared in a temperature range between 45 and 55 degrees Celsius. You can stay easily, and even children can do that, or elderly patient, they can stay 20 to 30 minutes easily to get the benefits of infrared. And the main benefits are, on one hand, the body will be slowly heated up. This is good for your musculoskeletal system. It will definitely give you some relief for musculoskeletal problems on one hand. On the other hand, you will slightly start with sweating, and the sweating is a natural form of detoxification. This is why I'm really a big fan of infrared, and it's highly recommended open-minded, and if patients have access, they can do that every day while being on treatment.
Yeah, it's I have an infrared sauna in my clinic, and we use it quite often
Yeah,
for detoxification. I find it fantastic. I use it
yeah,
myself quite a lot. When patients always ask to explain, well, what's the difference between a standard sauna
yeah,
and an infrared sauna, I use the analogy. Well, it's like the difference of vacuuming your carpet and steam cleaning your carpet.
yeah, yeah.
They're
You're
both going
right.
to clean, but the one's going to do a better job because of the
Yeah.
penetration.
No, you're absolutely right. And, I had the same. So before my move, when I lived and practiced in Germany at my private house, I had always infrared sauna, and the whole family was using it.
Yeah, I think it's very vital. Now, I wanted to ask you about two other things. So, one other thing that I personally use in my clinic, we use red light therapy. So, we have
Hmm.
a red light therapy room.
Yeah.
And the second, you mentioned electrical devices. So, I'm not sure if you're familiar with the resonant frequency device, the Pearl unit. It's a proton emission device. So, the claim is there that it's in one of the few devices that's able to actually penetrate into the cell to change the frequency.
And you're absolutely right. So to give you some information, so the red light therapy wasn't available at the time I was running the clinic in Germany. But I'm very close affiliated to two clinics here in London, and part of the daily treatment is red light. So I can only highly recommend this treatment approach. It's definitely one of the good add-ons where you have a chance to make your treatment faster and to achieve much better and much faster good sustainability and a very good outcome. Regarding these frequency devices, and there are plenty of them, and I became very interested. So Germans are very open-minded for alternative treatment, homeopathy, naturopathy, traditional Chinese medicine. So I never had the chance during my medical training to practice that in the big hospitals. So it was definitely not the way of being trained. But latest, when I opened my practice, I have seen in practice this is a completely different life, and the treatment has to be different because you do not have access to all these fancy big machines in hospitals, whatever it is. Yeah, you have to find your own solutions, and there's not always really a good trial only with conventional medicine. So some of the illnesses are requiring complete different approaches, milder, better tolerable approaches, and so I became very open-minded, and I spent quite a long time in learning and achieving really high skills in all these alternative subjects like naturopathy, homeopathy, traditional Chinese medicine. I'm a trained acupuncturist, for example, and this is where I took a lot of advantage for the treatment for my patient. And coming specifically to these different forms of electronical devices. So, there are many of them, like Zapper, like biophoton machines, all that stuff. So, sometimes you will get the information that these devices are able to kill directly pathogens like bacteria, parasites, and bacteria. So I was a bit skeptical, and with my scientific background, I was very well connected to research units. And between 2008 and 2010, I set up a collaboration with the University of Vienna. This is in the new countries in Thuringia. And we have been very specifically interested in the outcome of these electronic devices. Is there any killing effect on pathogens? So we had a test setting where we cultured certain bacteria, and we exposed these petri dishes to different devices to see what's going to happen. And the typical frequencies which are used or very often used didn't have any effect, any killing effect. Yeah, there was absolutely no doubt. So there are frequencies which are able to kill directly bacteria, but the frequency bands are much lower than the offered frequency in Zapper or Rife machines. Yeah. And this is what you pointed out, there's a different effect. And this effect is so important. With these frequencies or biophotons, you can change the intracellular milieu. And this is what we have been able to approve. So if patients have been on antimicrobial treatment, whatever it was, conventional antibiotics, herbal antimicrobials, and if they got additionally one of these frequency machines, they definitely achieve much faster good outcome. And so there has been really evidence that the change of the intracellular milieu makes the pathogens in that environment much more vulnerable if you use these machines at the same time. Yeah, usually Borrelia or all of the tick-borne diseases are best protected in the intracellular space. Yeah, our immune system can't have a look in that environment, so it will be completely ignored. But if you make this environment uncomfortable by using these certain devices, you will start in a sense of alkalization. Yeah, you will change the intracellular milieu, and this will start or will push the bacteria or parasite out of their protected environment. Yeah. Again, there's no direct killing effect, but the changes of the intracellular environment are very supportive and beneficial for patient because it will push the bacteria to all the location where they are much better accessible by antimicrobial treatment, whatever it is.
So basically, for the layperson that may be listening, basically we're changing the terrain so it's an inhospitable environment for that specific type of infection.
Yeah, you're right.
Yeah, exactly. So, okay, is there a difference in the way you tailor treatments for, let's say, early versus long-standing illness?
No, definitely. Everything is much easier, and this is exactly one of the obstacles you shouldn't miss. So if there's an early stage of transmission, an acute infection, then you have nearly 100% chance of full recovery. As earlier you start after getting confirmation, as better it is. So according guidelines, so NICE guidelines in the UK, CDC or IDSA guidelines, there's a recommendation to treat patient on average with 2 weeks. Other studies have shown that is most often not sufficient enough. So on average, the recommended treatment length of treatment is 3 to 4 weeks to be absolutely sure. But in these acute stages, one antibiotic is enough. There are also alternative solutions which you can take in consideration, but there's definitely still some risk of risk, unfortunately. So probably the safer option in acute stages is to go on conventional medicine. But latest, when we have evidence of chronic stages, and again, per definition, chronic stage will start if patients have longer than 6 months same or certain symptoms and complaints. Then we are talking about chronic stages. A part of that, we have also late stages. So these are the very complicated cases. The approaches for chronic or late state condition are different. So generally, we can say there's a conventional approach. If patient or the doctors will choose for that way, one antibiotic is not enough. So the standards are, meanwhile, you need a triple drug course, 3 different antibiotic classes at the same time to achieve some good outcome. This is less and less used because of, let's say, sometimes serious side effects, intolerances, gut problems, and so on. So more commonly, doctors are using, in the majority of cases, so-called mixed protocol, 1 or 2 antibiotics, and the rest could be fulfilled by very good herbal antimicrobials. Or the third approach is to trust completely the alternative throat. So I spent quite a lot of time starting in the 90s. There was a legal problem in Germany. So I've used all the well-known American treatment protocols, Byron-White formulas, Susan McCamish Beyond Balance, and all the others. I became good friend with Stephen Buhner. He's one of my heroes, I have to say. I spent quite a lot of time in the US to learn from all these guys and to get a better understanding what alternative treatment really meant. And finally, so I started as in the most commonly way to develop my own tinctures, and I tried to prefer European herbs like teasel, for example, is definitely well reported in the literature that teasel can do a great job for Borrelia, but it unfortunately it will fail for many of the co-infection. You need a much broader approach, finally different herbs at the same time. So I started first with tinctures, but at that time most of the tinctures had been based on high percent alcoholic base, and so I burnt my fingers with some patient. Germany had a big problem with alcoholism, so there's a high percentage of patients, and I made really some really bad experience, and I was always looking for some other options. And a bit later, or in the early part of my career, but later after the tinctures, I came across with a New York doctor, well known, Dr. Zhang. He was theorizing what he called the modern Chinese medicine. So he used the old herbs, but in new formulas. So in dry formulas, in capsule form, with defined dosages. And that was a different approach than going for the typical tinctures. And I became very fascinated about his approach. And, my problem was I'm not a pharmacologist. So it took some time to get the understanding and to find really some good guys supporting me in achieving these dry formulas, but finally I made it, and this is why I'm behind this company called Make Well. So this is based on my ideas, based on my learnings, well-introduced herbal compounds for certain indications. So there's a complete coverage of all the tick-borne diseases. We have I have developed some good, and all of the products are based on latest science, and they are fulfilling the latest criteria which had been defined by Johns Hopkins. So in the past 2 years, we had 3 major studies or clinical trials from the US confirming which herbs should be part of good treatment. And the most challenging part in treatment are actually regarding tick-borne diseases, the so-called persister or stationary forms. That means this is a very specific survival strategy of Borrelia and Bartonella. So it's not anymore the problem of changing shape and condition, so what we call pleomorphism, or the intracellularity, height, and other body cells. This is what we have treated all the time. And while missing this stage of persister forms, probably that was the reason that a certain percentage of patients have failed and got very early relapses or fallbacks. But latest, around about 5-6 years ago, when Johns Hopkins more randomly discovered very specific microcolonies embedded in connected tissue protected by a slimy environment, which is called the biofilm formation. So when that was first time seen, these guys at Johns Hopkins started immediately to check the efficacy of the former use treatment protocols. Unfortunately, learning that none of the former use protocols had been sufficient enough to crack the biofilms and to get access to the persister forms. And this was the start of a new era of treatment. So we had to start to optimize our treatment protocols, and we have this development seen in the conservative or conventional treatment. So the outcome was that you need these triple drug courses to get really a chance of destroying biofilms and finally killing the persister forms. And we had the same learning lessons for alternative approaches. So most of the protocols, whatever it was, had been really good, but none of the former US protocols had really access to the persister forms. And one of the most missing links was the cryptolepis, so which should be almost part of any of these alternative treatment protocols. Without cryptolepis, you won't have any chance. And this is interestingly or more randomly our learning that for the persister forms, you have to include antiparasitic medication. Sounds crazy, but the antiparasitics are the ones which are essential to get really the best outcome and which is giving patients first time a chance of full eradication.
Excellent. And so would that include oh, sorry, my head just went blank now. There's the popular anti-parasitic drug right now that's in the news quite a lot. My head just
ivermectin.
Ivermectin.
I'm personally a big fan, and I wasn't hesitant. So this is a funny story, by the way. So when I entered first big conferences in the US long time ago, more than 20 years ago, there had been a certain percentage of doctors at that time favorizing the treatment with ivermectin. And I couldn't believe that. No one in Europe has ever used antiparasitic medication for treatment of bacterial infection. So I was really lacking of some good understanding why, and no one was able to explain me the effects or the therapeutical effect of antiparasitics. And I had really at the beginning some big issues to go for the first trials. I did that first when I came across. I'm not sure, and I don't want to dig deeper, but there's a very specific form of Lyme disease. So we estimate that 4 to 6% with chronic Lyme condition, they have a very specific form of cutaneous form of Lyme disease, and this is what we call Morgellons. I'm not sure if you are familiar with Morgellons disease. Most of the people are thinking that this is more a mental disease or delusional parasitosis, but it isn't. There's a lot of evidence, and I was part of most of the research group in the past 20 years looking into that matter of Morgellons. And so when I started to take care more and more for Morgellons patients, so I came first time across in the US, and when I entered my first conference, I had no clue what Morgellons was, but I was lucky sitting between the world leading experts, Dr. Ray Stricker and Dr. Jinder Safely. One was on my left side and the other on my right side. And the first question I got, how many Morgellons patients have you treated? I said, what is Morgellons? I've never heard about that. And then they gave me the first introduction. I said, oh, the Americans are crazy. I can't believe that is. But when on my flight back, that's still in mind, and all the new information. So I took in consideration. I said, hey, these guys are right. You have almost seen in the past many of these patients, but you thought they are really crazy. You had a lack of understanding. And then from this point on, I took Morgellons very serious, and there are a lot of patients out there here in Europe dealing with these conditions, and so I became very interested in that matter and very passionate. So we did a lot. So under the roof of my former clinic, we had our own research department, and so we set up a lot of collaboration with researchers in Canada, in the US, to dig deeper and to find solution. And one of these solutions had been ivermectin. So I wasn't any more hesitant. So, at the beginning, everyone's believing was that Morgellons is in some way an unknown parasite. But it wasn't, but because patient responded very well on antiparasitic treatment even with that ivermectin stuff. And interestingly, so based on the or latest in the pandemic, we have learned about the importance of antiparasitic medication. Without antiparasitic medication, you have no chance to get access to the bacterial persister forms of certain infection. And probably a high percentage have parasites in parallel at the same time. It's very often beneficial to go for this trial with ivermectin. And I've treated successfully, even in the pandemic, patient with acute COVID infection. I'm pretty sure that ivermectin was part of a treatment protocol, which was life-saving for some of my patients.
So then the ivermectin would have a part in dissolving this biofilm?
It's not a matter of the biofilm. So the biofilm busters or biofilm killers are different agents. So one of a very strong one is the NAC, the NAC, N-acetylcysteine. Yeah, this is a very strong biofilm killer right from the beginning, and that was also life saving for one of these COVID infections, specifically at the beginning. With the first variant affecting the lung, the NAC was definitely life-saving in combination with ivermectin. But at the moment, we use the NAC primarily for killing of the biofilms. Beside of that, we can also think about specific proteolytic enzymes, like serrapeptase, nattokinase, and others, which are very helpful to destroy the biofilms, and that will definitely ease the access to the persister forms. And without biofilm busters in parallel to any forms of antimicrobial treatment, probably you have a high risk of treatment failures.
Yeah, it's in my clinical experience in my clinic, when I learned about the biofilms and biofilm busters, it made a dramatic difference in the treatment responses. And just for the people that are listening that are still wondering what a biofilm is, essentially it's like an armor, but it's not like a hard armor. Like you said, it's kind of like a gelatinous goo.
Yeah.
And when you use these proteolytic enzymes and adenosine, it thins it out or kind of pokes hole, which allows the treatment agent to use in your blood cells to help weaken it. Yeah.
And the interesting observation we have made when we started the first trial, before introducing these naturopathic remedies I've mentioned in these solid forms, we did first at the University of Jyväskylä in Finland for in vitro testing to find out more about the efficacy. And one of the observation we have done right from the beginning, that certain combination of antimicrobial herbs, specifically the combination out of Artemisia annua, monolaurin endographis, and the garlic extract. In this combination, we have seen immediately the killing of biofilms. If you put Borrelia in a petri dish, and if you do that in the incubation in the right material, you will see immediately, or not immediately, but slowly, the growth of the bacteria or the replication. And so within a couple of hours, you will find not only the spirochetes, so the first original form of Borrelia, snake-like bacterium. So within a couple of hours, you see first intermediate forms, L-form, bleb forms, and then after some time, round body forms. So then Borrelia is looking like a staph or a strep bacteria. And they will also start very soon to build up these biofilm formation, even in the petri dishes. And we had been very surprised when we learned putting these antimicrobial formulas into the petri dishes in certain concentration, that at first there was a killing of the biofilms. So there was no more protection, and then we have learned, and this was really a fantastic observation, that these herbal combination I have put together cracked not or killed not only only the original spirochete, though we get also access to the round body forms. And this gave me finally the confidence to introduce that routinely into my clinic. And we have had over the time many different cohorts of different treatment approaches to compare the outcome to each other. And I can only talk very good about the outcome of alternative treatment. It's not far away from conventional treatment. And I'm convinced that the sustainability is much better in going for alternative treatment. But sometimes there's so much pressure on patients that they have to function as fast as possible. And so they will decide on other treatment protocols to accelerate their response. You have to weigh this between all the risk factors. Sometimes it's justified, sometimes not. And the treatment protocols I'm using give you the chance at any time to switch from very mild to speedy up and to push patients in let's say higher levels of efficacy. But you can also go the other way around. So if patients are showing up with intolerances for invasive treatment, you can shift these patients to alternatives without any loss of efficacy later on.
And would you kind of judge that by, let's say, Herxheimer reactions that they would be having if you would step it up or down?
Very good question. So on average, I would say for all different forms of treatment, you will automatically come across with Herx reaction. So on average, 30 to 40% will show up with Herx, the majority not. So if that happens, it's not a very serious problem from a medical perspective. It's very inconvenient for patient and sometimes a bit challenging, but I see that not as something very negative. So as long as patients are informed, as long as you are prepared for the onset and then to make the right decision to give patients support, I'm not concerned or afraid if that happens. But there's a big difference between Herx reaction of conventional treatment and Herx reaction in alternative treatment. What are the main differences? So in conventional treatment, that means with antibiotics, you can expect Herx reaction most often in the first week, sometimes on the first day of treatment. So very early, and this is completely different due to my observation in with these alternative or mainly naturopathic protocols. So the Herx reaction are most often seen, if they occur, around mid of the second month. Yeah, and I was wondering why, but meanwhile we have the explanation. If you start with herbal remedies, it will take some time to build up the needed trough levels, and on average, depending on the herb which is in use, it can take up to 3 to 4 weeks to build up really high trough level. This is much faster with conventional antibiotics, but so it's a milder approach and more convenient for the patient. And when patient for at least for 2 to 3 weeks on these high trough levels, means highest concentration of the herbs, then you will see more likely Herx reaction, and this is why you see that delay. And so usually in patients with conventional treatment, it's a matter of a couple of hours or maximum 1 day, very rarely a second day. And this is also a bit different what I have noticed in patients under herbal treatment. So they have, let's say, a bad week. So it's somewhere between a couple of days, maximum 1 week, where patients feel a bit worse. So some of the older symptoms are more intensively noticed. Sometimes they're noticing some new symptoms which they never had been aware before. But after this week, then usually you have constantly improvement. Yeah. And
Okay.
so that was my learning. So Herc's reaction are seen in both different approaches and the same in the mixed protocols. Then it's something in between, but not more than 40% of the patient will respond with Herc's reaction.
Thank you. Thank you. So we've discussed a lot about treatment methods and modalities, and that the one area that we haven't touched and is nutrition. How would nutrition play into this? Diet types, would that affect some better results with certain types of diet and not with
Oh,
others?
it's so important. I always I'm sharing with my patient always two types of protocol. The first I call the core protocol. This includes all the antimicrobial stuff, conventional antibiotics or the herbal compounds, herbal antimicrobials, and patient will get what I call additionally a support protocol. The support protocol will, on one hand, cover the potential risk of antibiotics if they are in use. So, obligately, always pre and probiotics. They are a must in conventional treatment, but also the probiotics can enhance the microbiome. So on lower dosages, I always include some pre and probiotics. A part of that essential is also coenzyme Q10, because one of the very well-known side effects of antibiotics could be mitochondriopathia, so harming of the, let's say, a power station of the cells. And with a certain level of coenzyme Q10, so on average 200 milligrams a day, you can cover that risk sufficiently. And a part of that, any of my support protocols will include a certain amount of anti-inflammatory substances. So to give you some examples, either some curcumin or omega-3 fatty acids, or very specific. It's depend on the inflammation or the symptoms patient are presenting. That could be also bromelain or resveratrol. If patient have serious problem with inflammation in the brain or in the nervous other parts of the nervous system, I became a big fan of resveratrol and alpha lipic acid, for example. So automatically always included is some gut support. Many of these patients are dealing with very specific health condition like a leaky gut. So specifically the ones which have been never treated before, and when these complex illnesses are well established, you can be sure that there are different forms of inflammation in the smooth tissue of the small intestine, of the upper part of the GI tract, or the colon and small intestine. This is something you should always cover at the same time. And another big part is really to enhance the immune system, to build up a very strong immune system. There are plenty of options to do so. Many patients are dealing at the same time with environmental toxins. That could be exposure to mold, exposure to heavy metals. This is also something we can't ignore. And so the exposure to these environmental toxins could lead to a delayed or non-response of your antimicrobial treatment. So it's good to know before starting treatment, even trying to find out in the medical history. So asking the typical question, if there was any exposure, have you lived in a dump environment, for example? If so, then sometimes it's a good idea to check that with some diagnostic tests to get a better idea how serious the problem is. So if that is, let's say, on a minor level, you can start some detox at the same time. If there's a serious problem, then you have to make strategical a decision. Then a detox comes first before being focused on the chronic infection. So a lot of thoughts you have to do up front before having really a final decision how to proceed.
So based on what you've said, if we're looking at dietary wise with food, would you be in agreement to say somebody that should be on a low glycemic diet with sufficient proteins and fats that we can be able
Yeah,
to heal the gut
yeah.
effectively.
Yeah. As we both know, there are multiple different offers of very specific diets. So I want to keep it relatively short and not to overload my patient. And the easiest, which more or less every patient can accept and perform, is what we call the Mediterranean diet. So that means a lot of vegetables, a lot of salad, some fruits. There are only less numbers of fruits which are not recommendable, but most of the time you can eat fruit at the same time. You should some proteins are very important. So not every day, but on 2 or 3 days a week, proteins in form of fish or meat. And if it comes to meat, you have to be very careful. So I would generally recommend only poultry, so chicken or turkey. You should definitely keep your fingers off any form of pork or lamb meat. I know this is probably a problem in Ireland or in some, but so if you go for pork or lamb, you will automatically enhance the inflammation. Yeah, there are good studies out there confirming that. So I'm not saying you can't eat anymore, but you have to be careful while being on treatment, because any meal which contains, let's say, higher amounts of pork or lamb meat will definitely drive your inflammation in local areas. So this is important. Then regarding other, you should definitely look for a healthy diet inform less sugar. Specifically, the refined sugar should be not a part of your diet while being on treatment. So there are also good studies out there confirming even you have no gluten allergy or intolerance, a lower amount of gluten is beneficial, because gluten can also contribute to higher amounts of inflammation. And then most of the patients have made their own experience. So with other food intolerances, so many of patients are lactose intolerant or fructose intolerant. So if you have all these information, it should be part of your diet. And what I mentioned at the beginning of our discussion. So more than 90% of these patients have massive depletion of their vitamin stores. So they are very low in vitamin A, in mostly all the B vitamins, vitamin D deficiency, vitamin C deficiency, and it would be also good to have a good understanding where patients are, because that should be part of your diet or your supplementation to fill up the gaps. This will definitely shorten the length of treatment.
Oh, absolutely. When we do comprehensive testing in the clinic, it's actually shocking how low
Yeah,
people are in their
yeah,
nutrient levels, because
you're absolutely
you
right.
could take standard food pyramids, and I look at it and I go, who made this up? It's
Yeah,
ridiculous.
uh,
We should sometimes turn that thing upside down, and we probably
yeah.
would be better.
Yeah, you're absolutely. And there's one point I do not want to miss, and these are the genetic predisposition that seems to be also playing a major role in this game of chronic condition. So on average, minimum 30 to 40% of the European population, and we are talking specifically of the white population, are dealing with methylation problems in form of MTHFR polymorphism. So mainly two forms of gene mutation could be found. One is affecting the so-called C677T and the other A1298C mutation. And this is a widespread genetic predisposition. So, and this has a certain meaning. So even if you have the milder form, the heterozygous form, then your absorptional capacity in the small intestine is limited to maximum 70%. So that means you won't get access to 100% of the supplements and medication. And if patients are unlucky, if they have the more serious form, the homozygous form, then only around about 20, maximum 30% of all the supplements or medication will be absorbed properly via the smooth tissue of the small intestine. And this is something which you can easily balance with so-called MTH protocols. So these patients need urgently some specific forms or the active form of vitamin B12, folate. It's also recommendable to add some magnesium glycinate and some zinc to compensate this deficiency and to get patient in a good position with relatively normal absorption. And again, so statistically 30 to 40% of the European population are dealing with these issues. And due to my observation, we have to take in consideration, and probably you have the same issue, the patient showing up in your clinic or in my practice, they have, this is a pre-selected group. And I've noticed that more than 50, nearly 60% of my patients are dealing with these genetic issues. And this is a once a life testing, even you have it or not. And this is important because that can affect also other illnesses which can show up at later stages of your life. Yeah, if you have some of these methylation or some one of these both mutation, you have a 4 to 6 higher risk of ending up with thrombosis or embolism, for example. You can develop very specific forms of cardiovascular diseases. You can get very specific forms of migraine-like headache, and many other health conditions could follow these genetic issues. So I would say it's meanwhile mandatory to check patient after the first contact on these genetic condition, because that is also one of the reasons I see quite often for treatment failures. So, I'm pretty much aware that there are a lot of patients who can't afford or can hardly afford diagnosing and treatment. But this is an important information. And if patients are getting the money for treatment and you have one of these conditions present, it can really lead to very serious treatment failures, and you're spending a lot of money on treatment without having any chance of getting benefits out of the treatment. I would definitely include in the first round of diagnostic all these a minimum profile of genomics.
Yeah, I agree. It's very important, and I test homocysteine quite often with patients because I find it a really good marker to see where somebody is. Like you said, for cardiovascular issues, methylation issues, even it shows in research elevated levels later in life you can be more subject to Alzheimer's, dementia, and the likes like that. Because all those key nutrients are deficient. I think coenzyme Q10, B12, essential fatty acids play a big role in that.
Absolutely, I totally agree.
So
but this is what you can find only on these specialized specialized doctors trained in functional medicine, so running these integrative approaches. They have a much better understanding of what is ongoing, and they are not focused only, let's say, on one part of the illness. So they are really checking more or less everything, and so that will definitely save a lot of time and money finally to achieve a good outcome of your treatment.
Absolutely, and I'm actually taking a personal mission right now, developing a training course for clinicians and physicians to teach them functional and integrative medicine approaches. Now, I know you yourself, you often offer different clinician trainings with the BCA or the Make Well, areas that you work with. Can you tell us a little bit more if somebody is interested in getting training, how they would
Yes,
go
of
about
course. So,
doing that?
so I made a general decision, more than 30 years I spent with patient, more 6 or 7 days a week. So 24/7 at least. So I was responsible always and in charge when I had still my clinic. But meanwhile, my focus is a bit different. So I'm seeing patient only on 2 days a week because I made this decision to spend more time in training other doctors. So I'm in charge of several clinics at the moment, 2 in the US, at the moment 3 here in the UK and 1 mainland Europe, where I'm sometimes it's a 1-day engagement per week to train exclusively the doctors in these practices or clinics if they have a specific interest in these complex illnesses, to learn more about these specific integrative approaches. And this is very important. I think, we are at the moment, so I can't judge exactly the situation in Ireland, but so my learnings, it's not an optimal situation or condition for patient. And we are pretty much the same here in the UK. I'm at the moment going back and forth to Germany. I'm still running a smaller practice out of my former living town and where I had my clinic. But I'm spending a lot of time also in the UK. But treatment I'm doing only out of Germany because this is much easier and I don't have all the legal restrictions. So I have my freedom. No one is telling me how to proceed, and this is different to many other countries. But let's say these consultancy for other clinic or doctors who are interested, this is where I spend a lot of time, and I guess it's needed because we have to develop a better infrastructure all over Europe. And this is why I'm so much engaged in these training purposes to spread more awareness, to train the doctors that they keep their eyes and ears open to listen carefully to patient, not to ignore, not to deny any longer. And again, we have discussed at the beginning the potential numbers of infected people worldwide, and this is around about 15% of the world population has Lyme disease. Official data, it's not based on my observation. Yeah, so it's a huge number. Yeah, so we are talking probably about 1.3 billion people suffering from Lyme. And this is something which you can't ignore any longer. And doctors should be more and more open-minded, or any forms of healthcare professional open-minded to this existence of chronic conditions of infectious diseases. And many other health conditions. To give you some examples. So everyone knows fibromyalgia. Yeah, if you look behind the curtain, 80 to 90% of patients with fibromyalgia have a history of Lyme. Yeah, autism. Yeah, or autism spectrum. So many of children and adults suffering from autistic disorders have a history of chronic condition or chronic infection, Lyme and Bartonella, beside the strep infection, or pans pandus, for example. There are a lot of health conditions out there where chronic infections are behind. Yeah, and I'm trying since more than 2 decades my best to really to spread more awareness, open-mindedness, not to deny, not to ignore any longer these chronic ill patients. And you know what the situation is. To give you a concrete one, there are 2 studies out there confirming it takes in Europe 4.5 year minimum to get a diagnosis of Lyme disease. Within the first 2 years, patient had on average contact to minimum 15 different doctors with different specialities. So starting with normal GPs, then specialists for internal medicine, neurologists. Finally, after 2 years, more than 95% of these patients are ending up with psychiatrists. So being told it's a psychosomatic or psychiatric illness. You are depressive. You are you have so many different forms of psychiatric illnesses, but that's not true. And these are really concerning numbers. So the fact that it takes so long time to get a diagnosis, then to be treated by many different specialists, and finally ending up in psychiatric wards or in psychiatric practices, getting antidepressants and other psychiatric medication while having a somatic disease, nothing else like chronic infection. So, but part of the chronic infection is the affection or imitation of psychiatric illnesses. And this is exactly what Borrelia and Bartonella is very often causing. These patients are not mental ill. They are not psychos. They have a real threat with chronic infection, and I can talk a lot about that because at a very close collaboration with one of the biggest psychiatric hospitals in Germany. So I was approached a long time ago from one of the heads, so asking the question: can Lyme disease cause psychiatric illness? Psychiatric condition? I said yes, because this was my learning in the US when I spent a lot of time over there. And then they became interested, and we started specifically in young ages to screen these patients, specifically when they have been non-responsive on a psychiatric medication. And I can tell you, very often there was a history of chronic tick-borne diseases. And surprisingly, when we changed the treatment focus in direction of antimicrobial treatment, so within a short time, a patient improved dramatically and had been able to be discharged from the hospital. And so when I started with my career, let's say as a Lyme doctor, I hate this word, but this is the term which is most often used. So there have been 8 doctors interested in that field, beginning of the 90s. Meanwhile, I was one of the founding members of the German Borreliosis Society. We got the same setting, introducing a so-called S1 guidelines. So on the same level as IDSA and the normal German guidelines. So meanwhile, there's a completely different situation. There are nearly 500 doctors spread all over the country. So in all areas, you can get access to Lyme doctors. And we are far away in other countries, and this is why I'm spending more time meanwhile for these training purposes, giving consultancy to raise awareness and hopefully to get more and more commitment by other colleagues or healthcare professionals, because it's really still the big suffer of patients, which is driving me. I'm 68 meanwhile. Even it looks probably a bit different, but I'm still on that level of passion that I can't stay without work. But the focus has changed a bit.
Well, you're looking great for 68. That's
No,
excellent.
thank you.
Means
Thank you.
you're doing something right.
This is my work, my daily work,
Yeah.
which I'm still doing.
Excellent. Well, Dr. Nicolaus, I would really like to thank you for sharing your insights today. What really stands out is your commitment to combining science, diagnostics, integrative therapies to give patients hope and results. And especially those that have been searching answers for years on end, and like you said, they feel really frustrated and, they get diagnosed like they're crazy or something. So we've covered the importance of accurate testing, the role of integrative strategies, and the need for patient safety and clinical education. So before we wrap up, if listeners want to learn more about your work, where is the best place for them to connect with you?
To connect via my website, so www.drcarstennnicolaus.com. You will find all the needed information, and There's also a chance if someone wants to keep in contact. So again, I'm not offering any longer on a daily base services for patient, and I have quite a long waiting time, unfortunately. But I hope that patient have this understanding that's more important really to share my skills and my long-term expertise with many other doctors to get a much better environment, that they can get locally access to Lyme experts in the future. And this is what I'm aiming for. And I have to thank you for inviting me. It was really a pleasure. So unfortunately, it was more a monologue from my side. I'm very sorry about that, but I'm hoping that I have
people want to hear from you, not from me. So that's perfectly fine.
I'm hoping that I was able to share some really good and important information for everyone dealing with one of these complex illnesses or situations. And my last words, I would say, never give up. There is in the overall majority of cases, there's a solution available. Yeah, and so this is my learnings, and I'm also being well known for never giving up and trying to find a solution. And I have to say, in most of my cases, I was able to do so. Sometimes there's a need to think out of the box, but my learning is really to look for these solutions because they are there.
Well, thank you, Dr. Nicolaus. I really appreciate your dedication to your field of work. That's really beneficial. So that's today. That's all for today for the episode of the Integrative Continuum. If you found this conversation helpful, please subscribe, share it with someone who needs this information, and leave us a review. I'm Dr. Richard Rocker, and I'll see you next time as we continue the frontiers of integrative medicine for resilient living. Thank you.
Bye-bye, also from my side, and all the best wishes.
Thank you for joining me on the Integrative Continuum. I hope today's conversation gave you new insights and practical tools for your own health journey. If you enjoyed this episode, please subscribe, share it with someone who would benefit, and leave us a review. It helps us spread this message further. Until next time, I'm Dr. Richard Rocker. Stay curious, stay empowered, and keep moving forward on your path to integrative health.